Does your dog need a mint? In this week's Pet Doc interviews, Roni Lewis sits down with Dr. Brandon Beebout to discuss oral health and why it's important to take care of your canines.
Is doggy breath a real thing? Well, Dr. Brandon Beebout from the Hilltop Pet Clinic is just joining us, and we're going to find out if it is a real thing. So, doggy breath, is there such a thing?
There is such a thing. You know, even from the early ages, you know, we'll see puppy breath is very, very common. And I personally don't like it. A lot of people do, and that's why they get their puppies. And that's not necessarily pathologic in origin. It's just the way that they are. But as we age, without a doubt, you'll find plenty of owners that say, I don't let my dog kiss my mouth because I can smell it from a mile away. And you know what we'll see is there's a lot of variation in that as far as the age of the pet, size of the pet, breed of the pet, a lot of different stages, I guess, of who's going to be that candidate of doggy breath. So an example of that would be an older Chihuahua, a Pomeranian, a Maltese, in comparison to your larger breed dogs, Labrador, Great Danes. They, for whatever reason, they think it might be the angle of the teeth and the size of the mouth, the amount of bone that's there, that they have both on their mandible as well as their maxilla, to have the ability to maintain their oral health without doing a whole lot. You'll also find that you know, your Chihuahuas are less likely to chew on rawhides, chew on bones, chew on the appropriate things, whereas a Labrador can't get enough of those things.
So is the doggy breath, I know we're talking teeth too, but is the doggy breath caused by anything besides, you know, not having the best of teeth?
So it can be definitely related to other metabolic disorders. For instance, kidney disease would be a really, really good one, depending on the health of that pet. So if we're not feeling very well and you've seen a sudden change in breath, you definitely can be looking at kidney disease. One of the things we see is uremia, and so same thing, the urine scald that you can have as a baby, for instance, in your diaper. Same type of thing. As those kidney values rise, we're more toxic. Those kidneys are not doing their appropriate job, which is removing those toxins, and so they build up. And one of the places we find it is in the oral cavity, and so there can be ulcerations from those kidney disease, just like again, urine scald. So we're scalding our mouth from the elevation of those kidney values, and so that would be a really, really good one when my dog's not feeling well and the breath has changed acutely, very, very quickly. And so another one would be diabetes. And so some people don't have the receptors actually that can smell ketones. It's a fruity smell, and so we'll see ketones in dogs with diabetes that start to struggle and start to get unregulated to the point where they're starting to have secondary conditions. And so DKA, diabetic ketoacidosis, would actually be a condition where we'll see that breath change acutely as well.
Okay, let's talk a little bit about teeth and taking care of the puppy's teeth or your dog's teeth at home. How important is that?
One of the most important things you can do for your pet. And so, you know, starting at an early age, you know, one of the first things I talk about, both at puppy kindergarten that we have here, as well as that new pet exam, you know, that's 45 minutes of me talking to you, and a lot of that, 15 of that, is about oral health. And so, one of the things, you know, that we talk about is, when do we lose our teeth? You know, by 6 months, both dogs and cats are going to have their adult teeth. Why do we brush prior to that? Well, because we want to get them used to it. We know that these teeth are going to fall out, but we want them to have those behaviors and those and that solidified in them being responsive and allowing you to do those things by the time those adult teeth go in. And so and again, it changes definitely on breed, but it is one of the most important things you can do for your pet, adding longevity to them.
That concludes this edition of Pet Doc. Stay with us because next week we're going to continue dental care at the Hilltop Pet Clinic with Dr. Brandon Beebout.
Thanks, Roni. You can find more information from our Pet Doc by visiting our website, nebraska.tv, under Good Morning Nebraska in the Features tab.